This is Natalie. She is 16 years old and she has paranoid schizophrenia. Her mom began noticing her symptoms a couple months ago, but did not realize how serious they were. She thought it was just normal teenage activity, but now the symptoms have been going on for about a year and a half and she is starting to get more worried. Today she is going to have a meeting with Dr. Forbes to discuss Natalie's disorder. It must be Dr. Forbes. Hello.
Hello, how are you?
I'm good. I'm Emily.
Dr. Forbes.
Nice to meet you. We can sit right here.
Alright, sounds good. So, what seems to be the problem here?
Well, for the past year and a half, Natalie's been acting a lot different.
Alright, let me just jot some notes down. Is she showing any symptoms?
Well, yeah, for example, she's been having a lot of sleeping problems.
Okay.
I can't sleep.
So, sleeping problems, that could be a majority of illnesses. What
Yeah.
else?
She also laughs in serious situations.
Oh, interesting. Natalie, your great-grandfather died today. Natalie, that's not funny.
And also a lot of times when I'm talking to her, she'll stare off and not pay attention. And I ask her why she's not listening. She says she doesn't even hear me.
That sounds to me like a catatonic state. I don't know if you know what that is, but it's really common in schizophrenia patients. They just stare off and they have a blank look on their faces. So yeah, it could be that, but we'll find out some other symptoms and we'll diagnose her later.
She also will hear people that aren't there, or will smell food that I'm not cooking or anything.
Oh, wow. Okay.
Emily, where are the cookies?
What cookies?
I smell cookies. Where are the cookies?
There aren't any cookies.
But I smell them. Where are they?
I didn't make any cookies.
But I smell them. So where are the cookies?
We don't have any cookies.
But where are they? You're lying to me. Where are the cookies? Okay.
Natalie,
Yeah?
there's no one there.
Yes, there is. He's right there. Don't you see him?
No.
Oh. He's there. Okay. Sounds good. Sure.
Is there any other symptoms I should know about?
She's indifferent when she has to make a really important decision. For example, we were asking about college the other day, and she didn't care at all.
Oh, wow.
Hey, Nat.
Hey.
Where do you want to go to college?
I don't really care.
You have to know soon.
Yeah. I don't care.
What do you want to major in?
I don't care. I don't know. Nothing's really interesting.
Who do you want to room with?
I'm not sure. It doesn't really make a difference to me.
Do you want to be in a sorority?
I don't care.
You have to know soon. She also seems to be paranoid, and she thinks people are after her, plotting against her and trying to harm her when they're really not.
Okay, that's interesting. I think we're getting closer.
Should I write that down?
Yeah, write it down. Oh my god, what are you doing?
Just getting my pencil.
Oh my god!
Natalie, chill. I'm just getting my pencil.
Thought you were trying to hurt me.
The last thing I've noticed is when we're playing games, she doesn't have fun anymore. I never see her having fun.
Did she used to
Yeah,
show
all
this
the time.
before? Really?
Yeah.
Oh wow. How long has this been occurring?
For about a year and a half.
Year and a half?
This is boring.
So do you have any idea what she has?
Well, from what you've told me and the symptoms you gave me, I'm pretty sure she has a schizophrenia. And there's different types of schizophrenia, and what I think it is paranoid schizophrenia.
Dr. Forbes has just diagnosed Natalie with paranoid schizophrenia. This type of schizophrenia can normally be treated and symptoms can be reduced. However, the patient very rarely fully recovers from this disorder. Natalie is 16, which is right in the range of when schizophrenia symptoms normally appear, which is around the age 16 to 30. Unlike other types of schizophrenia, patients with paranoid schizophrenia have symptoms like hearing people that don't exist more often than seeing people or things that don't exist. When Natalie is worried that someone is plotting against her, she is exhibiting a common symptom called delusions of persecution, which is when the patient thinks someone is trying to harass, spy on, or cheat them. Dr. Forbes suggested counseling and rehabilitation for Natalie to try. However, since she believes what she hears and feels is real, it was really hard for her to accept the fact that she needs therapy.
How's Natalie been lately?
She's okay. She's still experiencing almost all the same symptoms.
Alright, well, she's getting a little better.
A little bit.
Alright, so what I've been thinking, I think we should prescribe her with some medicine called clozapine, and that just basically helps with the symptoms. And yeah, some of the side effects of clozapine, it causes like sleepiness, drowsiness, some headaches and like dizziness, but that should only be for like the first couple weeks, and then the side effects should disappear after like 2 weeks. Okay. So clozapine can be prescribed like with a liquid, a shot, or pills. I mean, whatever you prefer or take is fine.
We'll do pills.
Pills? Alright, we'll do pills. So what we're going to do, we're going to start you off with some therapy and some simple counseling, and we're going to see if you get better. And if not, just call me back and we'll figure out something else.
After the therapy and counseling didn't help Natalie's symptoms to get much better, Dr. Forbes suggested clozapine, which is an atypical drug created to treat schizophrenia around the 1950s and is still common today. Clozapine is one of the most effective drugs to use to treat schizophrenia. However, Dr. Forbes did not suggest it first because it can cause low white blood cell levels, which can be dangerous for Natalie because white blood cells help to fight off infections. Other side effects of drugs used to treat schizophrenia that are sensitivity to the sun, skin rashes, blurred vision, accelerated heart rate, weight gain, and muscle spasms or tremors. About 1% of the general population has schizophrenia, and about 2.5 million people in the U.S. have it. Normally, patients who are diagnosed will suffer from symptoms their entire lives. However, after almost 6 weeks, Natalie's symptoms of paranoid schizophrenia were almost completely gone. She was able to build better relationships with her friends and family, as well as succeed in school.